Hello, welcome everyone to this event on driving health service equity through climate smart private sector engagement, a case for electrifying rural health clinics. Welcome to those of you tuning in from around the world, and welcome to our for those in the live audience joining us here in Glasgow on the very last day of COP26. It has been a 2 week whirlwind full of major announcements covering a broad range of sectors, from a new pledge to mitigate methane across all sectors, disciplines, and domains. And the third is that we must ensure that we use climate action as a driver for increased equity and environmental justice on lists. Joining us remotely is Michelle Laird. She's my colleague at Abt Associates, and she leads Abt's global development practice in Europe, Asia, Latin America, and the Caribbean. She brings over 30 years of experience in financial, economic, and public policy analysis. She has worked in developing countries providing financial and enterprise enabling technical assistance in areas including climate change, clean energy, economic growth, governance, agriculture, and health. Welcome, Michelle. We are also honored to be joined by Dr. Flavia Bustreo. Dr. Bustreo is a leading physician, public health professional, and advocate for health and human rights of women, children, adolescents, and the elderly, and is known for taking action on the social and environmental determinants of health. She is currently Vice Chair of Fundación Bodnar, Co-Chair of the Lancet Commission on Gender-Based Violence and the Maltreatment of Young People, and Chair of the Governance and Ethics Committee at the Partnership for Maternal, Newborn, and Child Health, or PMNCH. Dr. Bustreo was the former Assistant Director General to Family, Women's, and Children's Health for the World Health Organization from 2010 to 2017, and also served as the Vice Chair of the Board of Gavi, the Vaccine Alliance from 2015 to 2017. At WHO, she led the organization's work in reproductive, maternal, child, and adolescent health, climate change, aging, vaccination, health and human rights, and health and gender equity. Welcome, Flavia.
Thank you. Great to be with you.
Thank you. It is also my pleasure to introduce you to Ralph Ancri. Ralph is a business development manager at Orange Middle East and Africa. Specialized in emerging countries, he has worked since March 2007 to develop global partnerships for sustainable digital development programs in education, health, energy, and agriculture. Previously, he worked as a digital consultant during 7 years at Safricom, an Orange Group company, a leader in telecommunications consultancy and services provider. Ralph provides expertise on fast-growing markets worldwide as senior consultant for data and multimedia networks, and has participated in several missions in different countries in the Middle East and West Africa. Welcome, Ralph. And joining me here in Glasgow is my esteemed colleague, Paul Faith. Paul is a distinguished environmental economist with 35 years of experience in climate, energy, and water, managing environmental research, strategic development, and policy analysis. One of the earliest to focus on the economics of climate change, he led the design of the world's first carbon offset program in 1989. He has worked internationally and domestically in the United States on such key issues as climate risk, electric power, renewable energy, sustainable agriculture, and water. And we're very happy to have Paul as Abt's Global Technical Director, Climate and Energy. Welcome, Paul. So to get us started, I will ask each panelist an initial question to set the context. We will then have a roundtable discussion, and finally, we will open it up for a Q&A with the live audience here. So first of all, I'd like to ask a question to Michelle. Please, Michelle, help us understand the broader context here. Can you please share with us how do the issues of health, climate, energy, and equity and access come together? And why is there a need for the private sector to participate in these issues?
Thanks very much, Santiago, and thank you everybody for having me here. So climate change is a health issue. The health publication, The Lancet, has called climate change the biggest global health threat of the 21st century. So direct climate impacts such as the spread of vector-borne disease, increased heat, drought, severe storms, and flooding, as well as the mass migration of climate refugees, have health consequences that disproportionately affect the most vulnerable and marginalized populations. At the same time, the main driver of climate change, fossil fuel combustion, is It's causing major health problems now, contributing to air pollution that prematurely kills more than 7 million people a year. This is linked with inequity, as more than 80% of those premature deaths are attributed to, tend to occur in low and middle income countries. All countries will experience significant and growing health impacts from climate change, but low and middle income countries will see the worst effects as they're the most vulnerable to climate shifts, and at the same time, they're least able to adapt given weak health systems and poor infrastructure. And I know my colleagues will talk more about that. So hospitals, health centers, health workers are first responders to the health effects of climate change. And health systems will inevitably have high costs. They're going to bear high costs resulting from extreme climate events, and they must become resilient to climate's impacts. So some of the poorest health systems in the world are often some of the most vulnerable, both in harm's way, again, with climate change, and they're without tools and resources to protect themselves. The COVID-19 pandemic has focused attention on the inequalities and vulnerabilities of health systems across the world. The lack of, so in terms of COVID-19 and the vaccines, people think of cold storage, and the lack of reliable power in health facilities is certainly an important element that undermines the quality of healthcare for millions of people, especially in sub-Saharan Africa, and we'll talk more about that example of sub-Saharan Africa a little bit later. So tying it back to energy, so we've talked about climate, we've talked about health and energy, and the problem without, where health centers don't have electricity. So the lack of reliable power. So off-grid renewable energy solutions can provide a solution there. They can provide clean, reliable, and cost-effective electricity to hospitals and also health facilities in countries that have significant electricity access gaps. But the public sector cannot successfully and sustainably address these electricity access gaps in a climate-smart way alone. So that's bringing it now to the private sector. So this needs to be done with both the public and private sector support. The private sector can supply the technology, equipment, installation, workforce for operations and maintenance, business models for sustainable financing, and more. So I think I touched on all of the elements that you asked about, but my colleagues on the panel can explain more as we go on, and I'm sure you have other questions. Thank you.
Thanks, Michelle. So then let me ask a question to Flavia to even get a better understanding about this issue. Can you provide maybe a broader explanation about why access to electricity is so important in achieving health outcomes? And perhaps as part of your answer, can you also share with us a little bit about the work by PMNCH's engagement with the private sector and focus on the climate and health nexus?
Thank you so much, and thanks, Michelle, for that introduction that really sets the scene for our conversation. So I like to split my answer in two parts. There is, number one, the importance that electricity has for health and health outcomes among the population, especially the most vulnerable. And then I like to comment also on the second part, which is the contribution of the health sector to actually carbon emission, because the two things I think needs to be raised and discussed in this conversation. So concerning the first part, I think Michelle already alluded to, but in my mind, there is no better way of understanding how electricity impacts health outcome than to picture a woman in obstructed labor that requires a cesarean section. This is a relatively simple operation that, for example, in sub-Saharan Africa, and also some assistant medical officer can perform, but it is necessary, if this happens at night, it's necessary that there is a light to see. And this clearly has impact both on the maternal deaths. Let's not forget that obstructed labor is a key contributor to maternal deaths. It's roughly still or around a third of maternal deaths that are linked to this. And of course, there is a huge impact on neonatal deaths because, again, the results of obstructed labor is asphyctic baby, and asphyxia is around 1 million newborn baby that die from this. So I think this is maybe the best and the simplest way to look at why electricity is important. Then there is also something that Michelle touched upon, that is for the functioning of the hospitals and even the most peripheral rural health facilities, electricity is important for something as mundane as the cold chain. And now the COVID-19 has really highlighted, but the cold chain for vaccine conservation is not used only for COVID-19 vaccines. So we have all the vaccines for children that are requiring refrigeration. And that is important both in the health facility and in the mobile teams that provide that services. So this is the first part. Electricity is very important for the health outcomes. But the converse, the other side of the coin is the health sector currently, and these are the estimates from the Lancet countdown that Michelle mentioned. If the health sector was considered a country, it would be the 5th largest polluter in terms of CO2 emission, as it contributes to roughly 5% of the global CO2 emission in the world. So it's important, this conversation we're having today, because it also helps to understand how does the health sector reduce the CO2 emission that is currently contributing, and how does innovation and use of technology and technology transfer facilitates that. And we are so excited, Santiago, because at this COP26, the Partnership for Maternal, Newborn and Child Health, which is the largest platform, more than 1,000 partners, of which Abt Associates is also a member, but that has members from the private sector, from academia, a young people constituency. We participated to the COP with a very strong support for what WHO and the healthcare professional has put forward as a call to action for decarbonizing the healthcare sector. And so these, I think those are the important contributions that the partnership is currently making, and maybe in the next round I will also elaborate a little bit more. Over.
So let me ask a question now to you, Paul. So Flavia was talking about the importance of decarbonizing the health sector. So can you talk to us a little bit more about this? You know, what are the opportunities to decarbonize the health sector, but also to maybe use new technologies like distributed energy resources to achieve health outcomes?
Sure, thanks, Santiago. First, I'd just like to start by highlighting that I think most of us are probably aware that sub-Saharan Africa has the lowest rates of electrification of any region in the world. So it shouldn't be surprising to know that the rates of electrification of health centers are also relatively low. For example, about 25% roughly in that area of health centers don't have any power at all. And many of the rest don't have access to reliable sources of power that don't, that they don't suffer from extended outages. So generally the quality of power where it exists is, is not good. So even like I said, hospitals, major hospitals can, suffer from extended outages. And that's something that, that an alternative source of non-grid power could either support and backing up the grid, or completely change that supply. The other thing with to know is that the quality of the power is low, so it's what's called dirty power, and what that means is that there can be a lot of spikes. So the voltage can vary dramatically, and when you get a high spike of power for voltage, it can damage motors and compressors and the equipment that you have. For example, the compressors in refrigerators, the fans in computers, there's a whole variety of things, testing equipment and whatnot that can be damaged and have caused, very expensive problems in the equipment that they do have available by the fact that the power isn't good. So another thing to recognize is that the rates of electrification of healthcare facilities in Africa is also very low. I saw two studies. At the low end, it's the rate of electrification, meaning the increase in access to electricity, is only about 1.5% a year. And at the high end in Kenya, it's 4% a year. So at that high end, it would take 18 years to double the amount of access to electricity in Kenya, which is really just not acceptable. And it would be much better if that could increase at a much faster rate. One of the things too is that where power isn't available or where there's backup, it's typically diesel gensets or diesel generators. And in rural areas, the issue here is that the diesel is very expensive, and so it has a high hit on the budget. And also the supplies are irregular, so you don't know that you can count on the supply of diesel, and there may be extended periods where there just isn't the diesel power, so you can't operate. So there can still be periods where you have no access to electricity. Now, of course, as Flavia mentioned, there are emissions from the healthcare sector, and in addition to those that are on the grid and the sources of emissions from that, the diesel gensets, provide a significant source of for those where they do have emissions. And of course, locally too, they put out a lot of particulate matter. So, in the immediate area of that diesel genset, the air quality can be really terrible with, particulate rates that are quite high. Distributed off-grid renewable power, particularly solar power, is becoming a much more common response. And there are a couple of things that are driving this. First of all, in the last 5 years, the price of solar power has come down by 80%. And the price of batteries has also come down by 80%. And that's off of a trend that the 5 years before that, the price of renewable power came down by 80%. So the prices right now for new power, solar and wind are cheaper than coal. And obviously they're much cleaner. And another, the transition here, particularly in places that don't have the grid, the parallel here is like landlines versus cell phones. There isn't a landline in this building and in most places. And it's sort of the same thing when you think about, shifting to renewable power. If you don't have to build a grid and you don't have that cost, then that's another major reason in remote areas why distributed power can be so much less expensive. In particular, in terms of the cost, one of the things, there is a lot of capacity coming online to develop batteries. Just a couple of weeks ago, Ford Motor announced a $12 billion new facility to build new batteries. That's going to have a knock-on effect for the price of batteries all around the world. And in these areas that are remote, you do need battery power to be able to operate 24 hours a day. But that's really going to be very positive. And toward the resilience question, again, in these remote areas, in times of disaster and where there may not be access to sources of clean water, for example, the opportunity to have power can provide pumping and water cleaning facilities so that when a disaster does happen, and rather than having the grid go down, you can have distributed sources of those of water and such for a natural disaster.
Okay, thank you. So we have heard about the climate, the health, the energy aspects of this, and now I would like to ask Ralph to please explain to us what is the role of the telecommunications sector in all of this. Perhaps you could share with us a little bit about Orange's work in the nexus on climate, energy, and health, and also please help us understand what is the strategy or why does Orange get involved in this type of activities.
The button. Yeah, thanks for giving me the hello, hi, everybody. Obviously, we figure we work like since a year regarding the new concept on how to bring health um, to have facilities, energy, water, and connectivity, because we figure out the lack of the and like you mentioned before, the lack of energy, water in facilities to bring the vaccine and to collect data, etc. So we have a big problem, and we figure out of one of the big problem is not the bringing the equipment, because we have a bunch of pilot today, invest in the equipment. But the big problem today is the operation and maintenance. How to maintain this equipment for the long term. How to guarantee that this local installer will follow for the long time the survey of the equipment and manage the equipment well. And we heard that a lot of pilot after the pilot retire with the budget, the project failed because the health worker is not their job. They cannot take part of the time of the work to 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 manage and to control all this equipment, and this is a lot of works. So we figure out that there's a company today like Orange where is his job means what? Orange or MNO. I'm not saying Orange only, but MNO today as the hotline, as operation maintenance for connectivity. So there's their job, because for the connectivity, MNO is not manufacturer, is only distributor, and then uh, bundle, you know, the connectivity, the fee, monthly fee to manage this equipment. So I thought that why not the MNO could also manage the energy system and equipment for OEM. So we start, with USAID on GDA or Sierra Leone, this concept. So we're going to we start now because we signed already, the agreement for Sierra Leone for this concept, bringing many partners to uh, pilot and to test this new concept with PPP, public-private partnership, that aim the MNO to manage and coordinate installation and operation maintenance with all equipment, water, energy, and connectivity for the F Center. Yeah, so that's very important. So, and we could, and with this concept, we brought on board many partners, very interesting. I can mention in Sierra Leone, we have agreement with Gavi. It's very, uh, motivated, and they have a lack also for distribution of vaccine and to host in the fridge condition the vaccine. So Gavi is on board and very eager, to work with us and guarantee all this operation and maintenance. So yeah, and part of this concept is also bring to the F facility the energy, and we figure out also something how to promote and to help population around this equipment. So why don't we share this exceed energy, water, connectivity to the surrounded population, creating entrepreneurship. So now the MNO is not going to be involved on that, but selling exceed energy, water, connectivity to the surrounded population and creating hub around a facility hub give to the population at really very low rate to the population the exceed energy and water and connectivity. So that's the second part of the concept. So that's why, so we're going to start, and we start already in Sierra Leone a month ago. So we start with the survey, and we're going to, launch the project next year with the equipment and all this concept. So hope done for me. So I hope I answered all of your questions.
Yes, thank you, Ralph. Um, so let me maybe ask a follow-up question for Michelle. So, uh, in this case, we're looking at the collaboration and coordination of a number of public, private, and NGO organizations. So, Michelle, from your perspective, what is the role of the international development or from donors in helping to facilitate this coordination?
That's a great question, Santiago. And I think thinking about the example that Ralph just gave, so he mentioned as well, let's say deploying renewable energy solutions. We've already been talking about deploying renewable energy solutions to electrify health facilities in sub-Saharan Africa, for example. It requires overcoming significant barriers. And Ralph touched on a number of those. They include the lack of long-term financing and sustainable business models, incomplete or outdated data resources. There can be, thinking of all those players, there could be poor stakeholder coordination. Ralph mentioned that there's limited capacity in healthcare facilities and surrounding communities to operate and maintain the energy equipment. And there's sometimes limited enabling policies that support sustainable service delivery. So those are a lot of different areas, a lot of different types of barriers. And the development community, because of the type of work they're doing, is really well positioned to identify sustainable models, but also to connect the different players and to interpret and translate between them. And so those are the development companies that are implementing work. For example, Abt is working in health system strengthening and health service delivery globally, interacting with health ministries as well as health practitioners. And we're also engaged in improving the policy and financing enabling environment for renewable energy. And we're working with renewable energy developers. So we're working with these different types of players and can bring them together. In the example that Ralph was mentioning, USAID is a big part of that. So USAID, if people aren't familiar with the GDA, the Global Development Alliance, that's a structure that USAID uses where they leverage also private sector money, and it can be either funding or it can be in kind in terms of labor and technology. And so, and using and drawing in funds from Gavi, et cetera. So I would say Ralph already described a very developed, holistic model that they're working on with USAID, and that we Abt also are looking at this together with them.
Yep.
And are in co-design with USAID for a cross sub-Saharan type of model, also using that Sierra Leone one to then replicate across sub-Saharan Africa. And so when you're trying to touch on not just electrification and connectivity, but also the entrepreneurship, the empowerment and improvement of capacity of the healthcare workers, and improving quality of health service delivery by understanding what type of diagnostic equipment might go into the facilities after they're electrified. All of that is really a great place for the development community to work to get it going, and then hopefully have these self-sustaining models that will continue. So to try to test, to iterate, and to replicate, and then hopefully have all of this going. And I'll stop there. I'm sure my colleagues on the panel can talk more about how the development community and how their different organizations can help in this area.
Thank you, Michelle. So let me ask Paul again. So maybe you can also contribute some perspectives on that same issue. But in addition to that, you talked a lot about opportunities to decarbonize sort of the health sector, and you touched a little bit on the resilience aspect. Could you elaborate a little bit? Maybe, in addition to disasters, are there any other events that can affect the access of health facilities to electricity? And how can technologies be used to address that risk?
One of the key things when looking in areas that are arid or semi-arid that run largely on coal power is one of the key considerations is that they need water for cooling. And unlike solar or wind powered systems, which don't require any water for cooling, they need water to to keep the panels clean. But as societies grow, and in arid areas where water is already a scarce resource, for everybody on the grid, if the power develops in a way that requires less water use, the entire grid will be more stable. Because as droughts occur, what we have seen in India, there was a crisis maybe 5 or 6 years ago where 600 million people were left without power, and it was because there wasn't enough cooling water. France, whenever there's a drought, nuclear requires more water than anything else for cooling, and half of the nuclear power generators had to go offline because the temperatures were either too high for cooling or there wasn't enough water. So there's the immediate benefit to the people who are using the solar power, but there's a larger benefit to the entire grid as well by being less dependent on sources of power that require water for cooling.
Okay, thank you, Paul. Let me go back to Flavia to ask a follow-up question. So we've heard about some thoughts, for instance, from Ralph about the opportunities of engaging the private sector to collaborate with health facilities and electrification and other aspects. And as we heard, you're now engaged with PMCH, and it's one of the world's largest alliances for women's, children, and adolescents' health and well-being. And I understand you have a number of constituents, including some from the private sector. So can you explain to us how do PMCH advocacy efforts to facilitate investments in the healthcare, particularly through private sector engagement, align with these efforts to electrify rural health facilities?
Sorry, I was on mute.
So thanks for that, the opportunity to elaborate more on the Partnership for Maternal, Newborn and Child Health and the work that it does. As you have explained, it's the largest platform currently existing that has as a main function advocacy. So the new strategy that was developed last year has 3 areas of advocacy: the continued work on reducing maternal, newborn and child death, the aspect of sexual and reproductive health and rights, and a key goal is adolescent health and well-being. So the partnership has a function to advocate for these goals that I have explained, and it does that through a combination of using the voices of the partners, and there is a significant government representation led by the government of India that is represented by, in fact, the vice chair of the partnership is the current secretary for health of India. And the other strong constituencies such as the academics and the healthcare professionals, both the healthcare professionals that work on these issues of women, children and adolescent health, but also more broadly, the primary care workers, the nurses, the midwives, and there is a very strong and vibrant young constituency. We call it adolescent and young people constituency. In fact, they are the ones that actually maybe have been the most active in moving this platform to really address the impact of climate change on health and well-being of this population that are at the core of the advocacy. And in fact, they were there with you at the COP26. PMCH was represented by the young constituency. Now, there are different ways. The private sector is a strong constituency, currently represented at the board by Abt Associates and also by the president of WEF, the World Economic Forum. So there are many ways that this interaction between the partners can amplify the messages that the different partners are where they're working. So, for example, when I was hearing about the examples that the Orange colleague mentioned, one way that the partnership can contribute to this effort is to connect the dots. Even if the viewers would want to go to the website, they could see at once who are the partners in the Partnership for Maternal, Newborn and Child Health that are working in Sierra Leone, and who are they, and what is their focus, so they can connect. And of course, there can be advocacy efforts that are geared to the ones that are already engaged in this very important effort that you described, but there are also maybe others that are not informed and are not participating. Now, there is one point that I also wanted to say, which is there is a plan for next year for the group that is, we call it the knowledge. So there is this distinguished group of academics that is working on developing an investment case for why is it important to invest in women, children, and adolescent health. And one part of that investment case, in my mind, has to include the investment in decarbonization of the health sector, and two, what are the important investments that are required to ensure the services that are of importance for women, children, and adolescents. So that investment case, in my mind, is one of the tools that we can all use within the partnership as a tool for advocacy and for additional investments. Because as Michelle mentioned, the investments by development partners is key, because these new technology, they don't come without cost. And this is my final point that I like to make in this. We need to, as development partners, we really need to look at these aspects of inequities. And right now, we know very much that developing countries, small island states, sub-Saharan Africa, they have contributed historically the least to the global warming, and yet they are paying the highest price for climate change. And yet, when we talk about the new technology that can help us, they also, as Ralph has alluded, they have the least access to those technology, and they have the least access to the maintenance, and they have the least access to technology transfer. So when we think about these issues, I think one of the important aspects that where the private sector is key is how do we look at this technology transfer in a way that is beneficial for the private company that have developed the technology, but is also not creating dependence or needs for maintenance that otherwise the key players cannot have. Any of us that, like me, has worked for a significant number of years in sub-Saharan Africa, in South Sudan, in Sierra Leone, know very, you have picture, I have picture of all these solar panels that were acquired, that the development agency provided, and then they didn't work very quickly because of the issues that you have alluded to, of the maintenance, of the know-how by the health workforce, which is not there. So in synthesis, I think if we work with each other in the advocacy part, in advocating for increased access, increased investments, and also in seeing how this technology transfer can happen in a way that is beneficial for population health, this is the way that the partnership really can facilitate and can contribute.
Thank you. So maybe let's try to see, Ralph, if you can help us also understand a little bit this issue about technology that Flavia was referring to. Does Orange see opportunities to address other needs and to contribute to the delivery of health services in Africa, perhaps beyond the electrification of communities and connectivity? What could be the potential role of telecom in helping to address other needs?
Yeah, obviously we try now, and we have some requests on similar, I will say, starting from the public structure, like school education. So we talking now with our partner focus on education, with the Ministry of Education, to duplicate the similar concept around the school, and in rural area. So that kind of, and we can do also in agriculture, like creating a habit around the partner in agriculture land or distributor or crops, around the crops for agricultural farm, big farmer to create, hub with energy, connectivity, and water. So we have different, requests now from different um, similar, I would say, concept in over structure, like I say, education and agriculture.
Thanks, Ralph. So let me open it a little bit here among the panelists. So this question goes actually to my two colleagues, Michelle and Paul. Um, can you provide any examples of maybe models or approaches that were used to overcome the high sort of upfront cost of renewable energy investments, and also do you have examples, for instance, of cases where they were able to aggregate the demand of several energy users to then maybe be able to provide the return on investment that many investors are looking for?
Yeah, Michelle's up. Can I start? Is that okay? Or do you have you want to start?
Go ahead.
I have two examples from projects that I recently worked on. One that started last year in Jamaica. A key challenge is, as you mentioned, the upfront costs. The operating costs for renewables are quite low, and there's no fuel cost, which is great, but the cost is all upfront. And we actually worked with with USAID on a global development alliance, which Michelle mentioned, and with 8 partners, including 2 who were private sector partners, and they committed $50 million to for distributed renewable power, and USAID put in 4 million. And the innovation that really kicked the whole thing off, because there had been attempts in Jamaica before that had failed, was rather than having to go to the bank and get a loan, the companies provided leasing. And that's a very common thing in Jamaica. And so people didn't have to come up with a huge amount of collateral. They basically took the money that they put into to their electricity now, and they paid the lease. So it was an even there were savings of up to 30% in that sort of arrangement. So it was kind of a no-brainer to be able to do that, and that really got over that hurdle. To your second question about market aggregation, 2 years ago I worked on a project. I was team leader for a project in India that worked in 6 states across the country, and the focus was on solar rooftops for residential. And the whole point was just what you were saying, Santiago, about market aggregation, was each one individually would have been expensive, but there were 15,000 solar rooftops that were aggregated for about 225 megawatts of power, in addition to other things that were going on. But that aggregation made it attractive to the solar developers and made the price reasonable for the homeowners.
Okay, thank you. Michelle, would you like to add anything?
Sure, I'll add so Paul just talked about the investment in the equipment, which the upfront cost is certainly the most, but as Flavia has mentioned and Ralph has mentioned, the ongoing operations and maintenance is really important. Otherwise, you have these solar panels, you have equipment, and it stops working, it's not used because it's not being regularly maintained. And so Ralph talked about, and he can provide more detail on this GDA in Sierra Leone, but in terms of that model, what a really important component is the operations and maintenance. And so the innovation of that methodology, and one that we're looking at for across sub-Saharan Africa, I'll give a little plug. It's, we're trying to get partners in this health grid GDA, but it's designed to leverage the capabilities and the competence of partner mobile network operators. And Ralph was talking about those MNOs, so that's mobile network operators. And it's leveraging them to procure and install the energy and connectivity equipment, but also to provide the effective long-term operations and maintenance support for all of that installed equipment for energy, connectivity, and wash, because they're already going out, they're trained, they can be trained even specifically for this type of work. Another thing about that also is pulling in, they can train youth and empower women that are in the communities to also begin to do that work over time. And then another element of that model for Sierra Leone has been the financing too of that O&M. So that's another, the payment for that is going to be arranged and secured through an O&M sustainability, a dedicated O&M sustainability fund that's resourced by revenue streams internal to that model. So again, this model is starting out, and there will be a lot of lessons learned, and I know there are other models around sub-Saharan Africa, and we've talked about lessons learned, and that's part of the development community benefit is doing this monitoring and evaluation and pulling the data and tweaking and feeding it back in and refining, and it's just really exciting what can happen now.
Thank you, Michelle. So let me ask a question to Flavia and Ralph. So can you provide maybe some examples, where there has been a successful collaboration from the private sector and other stakeholders to increase electricity in health facilities? But also, could you explain whether those models that you have observed on the ground, are they scalable? Can they be replicated? Let's go first maybe with Flavia. We cannot hear you.
Apologies. I'm trying to keep the mute when it's not needed. Before I answer that question, Santiago, let me also say to Michelle that it would be extremely interesting, Michelle, if the analysis that you're doing, of the lessons learned, that you could share that with the partnership and with the different constituency, because obviously that's very rich, and it's very important that it is shared. Now, I can provide examples of how collaboration with private sector has helped, for example, the delivery of vaccination services through innovation like the drone man delivery of vaccination and vaccines. That was an innovation, for example, that as Gavi, the Gavi Alliance was mentioned, early piloted through Gavi and then used to delivery of vaccines in the most remote and the most difficult and challenging areas of the world, whether that is humanitarian challenges or climate change related events where it's very, very difficult to deliver vaccines. So this is an example of the collaboration with private sector, with the development and engineers that really were at the forefront of using a new technology like drone delivery and a health care service and the tool. But there is another aspect I wanted also to raise in this conversation, because we have the colleague from Orange, which is there has been a significant push in the global health community, including in PMCH, to look at the aspects of the digitalization of healthcare and the use of new technology such as artificial intelligence. And I can think about many projects that have used new tools, for example, new digital tools, for example, assisting primary care providers, mostly women in rural Madagascar, to accompany women during their pregnancy, facilitate that they access as facility for the delivery when it is time, accompanying the children during their healthy grow up. And this technology, of course, they require interoperability, and also they require that many of the partners and players in the private sector are involved. And so I wanted to ask a question to the colleague from Orange. How do you see it from your end? How have these attempts worked or not worked, and what have been barriers that you have seen from the public sector, from other partners and players that we can possibly together try to overcome? Because this is I think the value of a session like this is that we can have a dialogue between us. Over, Santiago.
Yes, no, I think, thank you. You're moderating better than me. Ralph, please, could you answer that question?
Oh, yeah, sure. Obviously, we started a long time ago with a public-private partnership, and mainly with Global Fund and Gavi. That's the first, partnership we had, a long-term partnership with Global Fund and Gavi. And I can, give you some of the example that we did with Gavi in Ivory Coast. It was, implementing a new platform to remind vaccination reminder to the mother, to integrate the newborn and to schedule the vaccine for the long term, and control and survey of the vaccination reminder. That's one of the platform we had. And Global Fund, we work a lot in several countries. So we start in Ivory Coast, Morocco, and DRC, mainly for, I would say, interactive platform and interoperability platform to survey, you know, the uh, um, work, health worker activity, payment, the salary of the health worker. So many things, collecting data from the diagnostic tools. So this is many examples. And one of the case that we have, and that's why I come back to this concept of energy and connectivity. The story was, we were in Google Found to try to collect information and data. And then when you visit some of the health center in rural area in DRC, we figure out there is no connectivity, no water, and no energy. So how you can collect information without the three basis infrastructure? So that's why we start, the co-design, and try to figure out the new concept with USAID for Sierra Leone. So yeah, for example, we have a lot of, example of the PPP already on health sector. I can give you over an education over example, but I'm not gonna spend, more time. Um, but yeah, we have several examples in health sector on the PPP model.
Thank you.
Yeah.
Let me see if anyone here in the audience would like to ask a question, because we have a few minutes. So why don't we take a couple questions, and then we'll see. If you could please introduce yourselves and also indicate if your question is directed towards a particular speaker.
Hi, my name is Luis. I'm a research fellow at the University of Aberdeen. I think it's a general question. You've talked about electricity facilities for healthcare, or for healthcare facilities, sorry. So this is the treatment side of healthcare. But what about the preventative side? What are the implications? I think if you could expand a bit on what are the healthcare implications of not having electricity in their homes, in their workplaces? And if so, where should the priorities be? If I'm a policymaker, should I electrify the healthcare facilities, or should I electrify the homes? Thank you.
Why don't we take the second question, and then maybe we can answer to them collectively.
Thank you very much. My name is Elizabeth Perry. I'm here with the Anglican Communion's delegation to COP. I have about 1,000 questions, but I'll stick with the key one, which is around how you identify the partners on the ground, the actual health facilities. So churches, faith actors are key providers of healthcare in many places, especially in sub-Saharan Africa, where they're kind of the leaders. So are you working with faith actors? And so that's one question, how you actually identify. And then I've also got lots of questions around the cost but maybe we can take that offline afterwards.
Okay. Perfect. So I think I'll ask Flavia to maybe respond first, and then we'll go to Michelle, Ralph, and Paul in that order. Thanks.
Thank you. Let me just start with the first question and say that there is no doubt that what we call the production of health starts in the home, and starts in the home from which is the environment where you live, the air you breathe. Let's not forget that when you talk about indoor air pollution, this is an important, very important killer, especially for children and for women that are the ones that are most exposed to indoor air pollution. And that is, the critical link with electricity, because most of that indoor air pollution is caused by the stove operated by fossil fuels. So when you look at this, it's not easy to give you an answer. Should you start from the electrification of home, or should you start to the healthcare facility? In the ideal world, you should have both, because the production of health starts at home, continues at home. But of course, if you have, just to continue on the air pollution, if you have a child that has developed significant asthma episodes, and that is one of the key findings that we're seeing both for children and for adolescents of the impact of climate change and air pollution, that child is likely to need health services, and health services provided from facility. So you cannot really dissociate the two, in my mind. And as a policymaker, you need to find the modality through which you can support both.
Thank you. Let me hand it over to Michelle and then to Paul, please.
Excellent questions, both of them. And I agree with Flavia that, you don't want to choose one or the other. Sometimes you have to choose one first, but one thing that we're looking at in our model is the health facility. It could be a post, and this goes to the other question too, which we'll also discuss. It doesn't have to be a particular. Who is providing healthcare in a remote location, right? And that's where we want to go. But once you've electrified it, if you electrify it in a way so that there is excess electricity, and also we've talked about water and connectivity, that can be provided to the community around. So it could be that excess electricity goes to a school. It could be right next door to little posts for, an internet cafe. It could be that entrepreneurs come and are able to plug in and work there, or have it distributed a little bit further. So hopefully the community is getting those additional benefits, and that improves well-being as well. Just the ability to learn, to earn more income, to have access to water and connectivity. And this is a huge problem, and we need to work with all types of partners, whether it's faith-based, different NGOs. It absolutely has to be done through players on the ground that are there, and choosing. Part of what we're working on and looking at the sub-Saharan model is, who does it make most sense to partner with in each particular community, in each country. And I'll pause there. I know we're running out of time. I want to give Ralph and Paul a chance.
So yes, thank you, Michelle. Paul?
Just like to emphasize what Michelle was saying about bringing resources to the community scale. In places that don't have clean water, or any electricity, or health facilities, focusing at the community scale rather than thinking about bringing electricity to each individual home, bringing water to each individual home. Bringing safe waters is one example. I used to run a water NGO, so I know a few facts. I'll stick to that. Being able to provide clean water, for example, which electricity can do through pumping and reverse osmosis filtration and the like, can reduce the incidence of child mortality under 5 by half, for the simple reason that providing clean water eliminates dysentery. And so the nutrients and the calories that a child does have, they can keep. So it effectively doubles the caloric reservoir that they have if they simply have clean water. And what's required is 20 liters per person per day. So if at the community scale, you can provide clean water with electrification, in addition to, the other health services, that is a huge gain for everybody.
Thank you, Paul. Ralph, anything you'd like to add?
I just want to say something on that.
I think you're
mention
mute.
something. Oh,
There you go.
you can hear me now? Better?
Yes.
Oh, okay, sorry. Just to to mention something. We imagine this new concept to sell exceed water and energy to the population. Why? Because we aware that to bring energy, water to each home, we're gonna takes a long time and needs a lot of money, much more that to bring today energy water for the air facility. Why? Because air facility, we have today easily things to bring funding for health because there's a lot of budget to strengthen the health sector much more than today we can have on, I will say, public for not public for bringing energy and water to each home. And also the F facility will become owner of the equipment. So the public, that's one thing I want to mention. The ministry will be on the equipment. They just only, you know, um, commit with the private sector to maintain their equipment. So the equipment, it won't be owned by the private sector. The equipment is owned by the ministry. So for this concept to bring to home, that's an alternative and complementary today to bring water and energy to the population. Mean that the population will have to come with the battery and to recharge, or maybe to replace the battery with another with the battery charged already, with maybe small amount to rent, or we have to figure out to bring to home and to use the battery for their own needs. So that is for me complementary.
Thank you, Ralph. So unfortunately, we have run out of time. I would like to thank all of you for your participation. I think this has been an interesting panel. I've heard a number of very interesting things, for instance, about how it is very important to think about sustainability from the moment that you're designing interventions, and for example, how you bring in a partner that can provide operation and maintenance to ensure that the program is sustainable, and then based on that, you can then perhaps replicate it and scale it up. It's also really helpful to hear how providing access to electricity can really unlock a number of other opportunities, from entrepreneurship to access to clean water and others. And so I think this is certainly something that I hope we can continue looking into and implementing on the ground. And thank you again to all our panelists and to those of you joining us today. Thank you so much.